On the House Ways and Means Committee. Appreciate your time. I'm doing just fine, and thank you. You say three things need to take place. Under the current system, doctors are sending patients repeatedly to get tests done that aren't needed, and they're doing it to save their butts, or cover their butts, essentially, so they're not being sued. That sounds to me like tort reform. Do I have that right?
Absolutely. We think that lawsuit reform, getting rid of the junk lawsuits, should be a critical part of health care reform. It's something we've, as Republicans, have been proposing. Look, this defensive medicine means extra tests. We've all seen that. The duplication and waste that comes from that. That's clearly something we need to address. I didn't hear the President mention that last night.
But are they talking about this in committee on the House?
Well, we offered amendments. We had 38 amendments to the bill when it came through the Ways and Means Committee. None of them were accepted, including the amendment to make sure that if there's a government-run plan, members of Congress and the President are in that plan. They rejected that.
All right, so it sounds to me like tort reform is not going to be a part of any bill that comes out of committee, even if we ever get a bill that comes out of committee. Also, you say, number two, regulations on health insurance are outdated. Give me an example of a regulation that you would change to make it better.
Well, for example, if you're in a small business, you have to buy health insurance within the state that your business is located in. Why not let small business people across the country pool together, get a larger pool, lower their costs, and get lower priced health care? Also, why not let states join together in what we call compacts or larger pools so they can bring a better product to people who need health care?
It seems like some of that's being talked about on the Senate side, and I'm not quite sure if it's relevant on the House side. But in the Senate committee, they're talking about doing that at the state level, right?
Yeah, they are talking about that in the Senate. We can't seem to make any progress on that in the House again. That was one of the 38 amendments we offered.
Seems like right now we're 0 for 2. All right, let's try number 3 now. You propose eliminating fraud and waste. I don't know anyone who's against this. We did a story 2 days ago. We found $65 billion in waste through Medicare and Medicaid in just the past 3 years alone. How would you fight back against waste and fraud?
Well, we think this is an important issue. You know, American people have numerous examples of where they've been double paid or they've gotten a bill and it's been totally wrong in terms of their hospitalization or visit. And we don't really see anything in the Democrat bill in the House that will really get at this issue. And as you point out, it's tens of billions of dollars, if not in the hundreds of billions of dollars. And we think bringing integrity to the government health care portion of health care, Medicare and Medicaid, we think that's a critical part. It can be done, it isn't being done, and we need to get at that.
One more thing here, because it appears we're 0 for 3, frankly. When you're in committee, do you believe the other House members talking about this bill, do they have a clear understanding about what the White House wants in it?
I think they do. Look, I think we had a pretty vigorous debate in committee. Unfortunately, it was only one day. I think it needed to be a little longer than that. But look, people are very engaged on this issue, and this idea that doing nothing is an alternative is simply a fictional argument. Republicans have been proposing concrete, positive ideas. We want to fix this. We want to do it right rather than quickly. What we've been hearing from the other side is this has to be done as fast as possible. And look, we think it's more important to get it right than to do it quickly.
Dave Camp, Republican from Michigan. Thank you, sir, for your time today. Good luck with that.
Thanks a lot, Bill.
All right.